to the program. Joining me right now is Dr. Apera Iorwa, who is the former national coordinator, National Social Safety Net Coordinating Office, that's NASSCO. He's currently the country director of FHI International, that's FHI 360, that's Family Health International 360. Doctor, good to have you on the show.
Thank you for having me.
Welcome to the program. I have to say that this is the man also that was at least part of the team that was involved in putting the national register together. So you have quite a lot of questions to answer this morning. So let's get started.
I'm happy to do so. Yeah.
Why is the National Social Register controversial? 62 million individuals, about 15 million households. Why is it controversial? Why are state governors seemingly jettisoning what you did with your colleagues then at NASSCO?
I would not say it is controversial. I would say the database is there for the state governors or whoever it is to undertake it. Perhaps because it's a new government and new administration and they're just coming in and they've not had time to engage with their handover notes, they might be led to think that it is not there. But the social register itself is developed by the state governments. It is actually a state social register. It is not a federal government register. It's a state government register developed by the state government based in the Ministry of Planning or the agency responsible for planning in each state of the Federation, 36 states of the Federation and the FCT.
So if you say that it's not, let me come in here.
Yes.
If you say it is not controversial, why are many Nigerians against it? It's not just the governors. Why are many Nigerians say that some of them don't even know those in the register?
There are two issues to this, right? The general sentiment of perhaps we Nigerians, or perhaps it's human nature that you always want to see things in black and white, or once you are not personally involved, then you doubt the other side of it.
If you're not personally involved, you should know those that are. We have
Yes.
poor people around us.
Exactly. So
the poorest of the poor around us.
Yes. So you have, in the social register, you have 177,000 communities. We all come from these communities. We all have villages, right? So it's a matter of you pick up your call now, your phone now. In your state of the federation, you have a state operations and coordinating unit. Call them and ask them, or call your community. In every community that the social register has been developed, there is a community list that the community members themselves sat down.
What do you mean by community? Is it like wards or how? Or local governments or how?
Community is the smallest unit.
Yes,
so
I
you
know.
have political wards and you have communities. So on average, we have about 26 or 27 communities in each political ward. And we know on average you have 10 political wards per local government. And we have average of 19 local governments in each state. The statistics there, the definition of what constitutes a community, a political ward, is there, defined by the National Bureau of Statistics and the National Population Commission that does our census. So when NASSCO was building the social register, this definition was gotten from Bureau of Statistics and the National Population Commission. We also worked with the National Living Standard Survey conducted by the NBS. NBS, the first one we used was the one in 2008, where the absolute poverty figure of Nigeria was put at 62%, meaning 62% of our population were in absolute poverty. Now, we supported, while I was there, we supported NBS to conduct the National Living Standard Survey. The report was released in 2020, April of 2020. And the report states that 42% of the total population are below the poverty line. And this is what forms what you call the first targeting mechanism that NASSCO used to define the register. We use that to define the poorest communities, where we start developing the social register in each political ward and each local government, and you work your way upwards.
Okay, let's take a quick break. When we come back, I'll be interrogating how you came up with the social register we have right now in the country. What were the modalities used and what were the indices that were used to arrive at the poorest of the poor in that register? Let's quickly take a break. We'll be right back.
You know, you can't tax poverty, and Mr. President said that you have to first create prosperity, so you then share, you know, out of that prosperity. So what we're going to be looking at under that, you know, pillar is we're going to be very detailed by sectors. So if you take real estate, you take fintech, the fintech guys, you just need to speak to them for 5 minutes and you feel their pain. It seems like everybody says, they are important, but everybody is stressing them and giving them a lot of headache. We're going to spend time with them. You know, we're going to be engaging with Nigerians in the diaspora. Sometimes we don't know how important their contribution is to our economy. Just sending us dollars to pay some bills here and there and providing dollar liquidity, apart from being Nigerians, first and foremost means that they are a good stakeholder we must speak to, people living with disability. So we look at those different stakeholder groups and industries, and we now say, what are the impediments they're having to deal with? There are people trying to do export. It's a nightmare. There are people trying to do import. It's a big headache. Can we just simplify those things so people really feel like the government is there to support them?
All right, welcome back to the program, Dr. Apera Iorwa, the former National Coordinator of National Social Safety Net Coordinating Office, NASSCO, is with me. He's currently the Country Director of FHI 360, but we're not talking FHI, we're not talking things development. Anyway, social register is also development. If we have time, we can delve into that. Yeah. Okay, his former office was responsible for putting Nigeria's National Social Register. Now, how did you arrive at that? Just before the break, I said I was going to come to that. What were the metrics used to arrive at Nigeria's social register? What makes up, who is a poor person in Nigeria? That's two. The third question is, a poor person in Abuja could be different from a poor person in Zamfara, could be different from a poor person in Kebbi or Zagon Kataf. So how did you arrive at an average point of knowing who a poor person is in Nigeria?
Okay, so maybe we'll start from the basics, and I think as I'm discussing this, perhaps challenge us a little bit to do a little bit of reading. So when you Google the meaning of social register on your internet or your dictionary definition, you will find certain definitions by Steve Devereaux, who is a well-known social protection specialist. You can find definition by the World Bank. If you go to the World Bank site, you find literature on the social register. Now, the social register is defined as an information gateway for potential eligible beneficiaries into any social safety net, social protection program. Owing from that, there are a number of methodologies to identifying the poor and vulnerable and registering them in the social register. One is the general census. Countries like Pakistan has used the general census methodology to define the social register. The other is by registration from individual. The Turkish government uses that system. In Nigeria, what the Nigerian government decided under the World Bank funding that I worked on was that we will use the hybrid model. The hybrid model combines 3 targeting methodologies. One is the geographical targeting. The next is the community-based targeting system. And the third is the proxy mean testing. Now, why did Nigeria adopt the three model? It's because of, first, the dynamism of our country. As you rightly said in your question earlier, the poor person in FCT will be different from a poor person in Zamfara. 1 kilometer in Nigeria makes another language. And so the context for which we view poverty, which is very relative, is different. So when we started it, we used the geographical targeting mechanism to identify the poor communities. The Bureau of Statistics, and you can go to the National Bureau of Statistics website, Google the National Living Standard Survey. You will see the figures of poor, absolute poor, for every state of the Federation. When this is cascaded down to the local government and the political wards and the communities, where you define the poorest communities, the poorest political wards from another. So the first targeting mechanism allows us to identify the poorest local governments within a state, where you start to build the social register and you work your way up. Now, after the geographical targeting mechanism is used to identify the poor locations, the next one is the community-based targeting system. And because of the dynamism of Nigeria, every community defines and sees poverty in a different way. And so what NASSCO will do, supporting the state government, who set up the state operations and coordinating unit in every planning ministry of the Federation, the team will then recruit the community-based targeting teams in every local government of the Federation. 774 local governments of this country has a local government-based community targeting system, team in their planning department or community development department. These folks will then go to each community, meet with the community, sensitize the community, and then the community will be divided in 3 homogeneous groups. This is the community-based targeting system I'm describing right now. The women will define what do they mean by poverty. So the women might say, if a woman is going to the market every market day, which of course we know market days are every 5 days, right? Every market day with 1 single wrapper, it means that woman is poor and cannot afford basic clothing, right? That is their own definition of a family that is poor. And then they will identify from that family, in that community, those who are identified as poor. The male folks will also be in their own group and asked to define who is poor amongst them. They will say, okay, the fellow that cannot afford to send the children to school.
So you say, of course, from your, sorry to cut you short, from your analysis now, that means the poor people in the community were the ones that identified the poorest of them.
Yes. It is the community members that sit in this 3 homogeneous group of women, youth, and male, define poverty within their context, identify the poor people. They are then brought into plenary, all 3 of them, and the list is now harmonized. So the male folks will read their list, the women will lead their list, the youth will lead their list, and it will be harmonized.
At that time, did you have your officials in those meetings?
Yes, every of those community-based meetings, it is facilitated by the local government team, who understand the context of the local government, who are themselves local government staff. So once they harmonize the list, the community select 1 male and 1 female that will sign off on this list, that this is our own community list. This is also done for accountability's sake and check and balances. A copy of this list is retained in the community. So there is community list signed by community members, 177 communities so far in the social register. And this is where the integrity of the social register lies. So if all of the governors or everybody that is, or if you and I go to your community, ask for the community list, you will see it in the community.
Who would I ask from? My OB or who?
Go to your OB and ask your OB. OB will know. What thing is that the OB is seated in that community engagement, right?
Are you saying that for people listening now and they want to verify, to go to their communities, should they go to their traditional rulers to verify, or go to the local government like you mentioned now?
You go to your community leadership, you ask them, they will tell you that the community engagement will happen here. A community social register is here. Here is Mr. Nwaboze or Ngozi that was selected by the community to sign off on this list.
So why are states saying that they want to replace the social register? Why are states not having that credibility with the social register that you and your team put together? If you're saying is this if you're saying is this robust?
Like I said before, they are new. I mean, they were just shown in May 2019, right?
2023.
May 29th. And they have their handover notes. Perhaps it's early days yet for them to engage thoroughly with those handover notes to those details. But all the state governors, what I tell them is call your Ministry of Planning, call the permanent secretary in your Ministry of Planning and ask them to come with their state coordinators of the social, the SUCO.
Okay.
Yeah, every state operations coordinating unit, every state. In fact, in Lagos State, the state governor has identified the social register as a credible source of identifying the poor and vulnerable. He has actually made SUCO now a full-fledged department to coordinate all social protection programs in the state. So perhaps maybe in that meeting, he was not present to say, look, this is how far I've engaged, because it is the second tenure. And all second tenure governors know exactly about the social register in their operations unit.
So don't you also think that Nigerians' bile towards the current social register we have is because of perhaps the experience of COVID-19? I know that you had a rapid response register, if I'm not mistaken,
yes.
At that point when COVID-19 struck, because the cash transfer was also emanated from this social register.
Yeah.
So Nigerians are showing this satisfaction because they also feel that the way this cash transfer was handled by the Minister of Humanitarian Affairs at that time was not good and not accountable, not transparent.
So we need to actually separate two things, right? The National Cash Transfer Program, as funded by the World Bank, it's separate from the cash transfer the government did around rural grants, right?
Trader money and market money.
Exactly.
By the former vice president.
Yes, all of those are different. The cash transfer is funded by the World Bank facility.
Is it the $500 million one?
Yes, with its attendant conditions. Of course, the World Bank cannot give the government of Nigeria a facility such like that without very adequate or stringent checks and balances to ensure prudence, right? And so that is what I managed. And for every person on the social register that is paid on that cash transfer program has its own identity, geocoordinate. The social register has geocoordinates. Go to www.nassp.gov.ng. You will see the social register. You will see the social register with geocoordinates that you can track and trace every single household. The COVID-19 cash transfer that was handled through the Rapid Response Register that the Vice President launched, every single individual that is paid has geocoordinates. You just need to go to NASSCO, you will collect those information, go to State Operations Coordinating Unit of each state of the Federation, you will collect the geocoordinates of each of those individuals and go straight to the individual's house to find out. The records are there. It has been audited. It has been audited by even the African Development Bank that supported the government. They collected geocoordinates at the time I was there. They went to those houses and they identified the individuals. So the information is there. We just need to engage with it. Like the state governors, like I will say repeatedly, just call your State Operations Coordinating Unit coordinator in the Ministry of Planning. Sit with him. Ask him or her how it was developed. Then he will let you into the register, collect the geocoordinates, set up a committee, right? Collect the geocoordinates and go. In Zamfara State, we had an experience where the governor was coming in anew in those days. And we asked him, okay, set up a committee. He set up a committee of his deputy governor and the speaker. And they went into the state, the now Minister of Defense. He will tell you this experience. Call him, ask him. He will tell you the experience. He set up a committee headed by his own deputy governor and the speaker. They went to the community without the State Operations Coordinating Unit. It was the community leaders that described to them the process for which the social register was developed. And this is how he approved for the cash transfer to happen in the state. So now Zamfara is using the social register for their palliative right now.
So how do you think that states should move ahead in terms of distributing palliatives, because states now have gotten 2 billion naira cash, at least I'm aware. A few states are beginning to share bags of rice, vegetable oil, and some other condiments to their citizens. Do you think that the way the palliatives are being, do you think that those palliatives are even right, as it were, for poor people? A lot of people are saying, if I eat rice today, the rice will finish. What will I eat tomorrow? Some people have also questioned the aspect of distributing cash. As at that time, it was said, okay, 8,000 naira when fee subsidy was removed, but of course now it is in the hands of governors to share whatever amount they want to share to their indigents. So what do you really think about that?
I think the federal government wisdom is right to push implementation to the state governments, right? Which actually that's where implementation is supposed to happen. So they're absolutely right to do that. Now, the state governors, in their wisdom, design their own palliative programs, and they have the right to it, right? And as defined by them, because they understand the context of their states, they understand the needs of their people, right? What I will encourage them to do is to then identify the poor and vulnerable by engaging by their social register. You and I were in Cross River State, and the Cross River State governor made a commitment that he is using the social register. He's engaging with the social register, and he's using the social register for the palliatives, which I say is a step in the right direction. Zamfara state government, even though it's a change of party, it's a different party, right, from the party that was. Yet the Zamfara state government is right now using the social register to distribute their palliative. That's the level of confidence they have. And we're asking the state government, engage with your SUKO, validate the register if you want to. Nobody's saying don't validate it, right? If you want, set up a committee. Let them pick the geocoding and go to each community and confirm that this was done by the community. The list is there. They engage with it. You have 62 million individuals in the social register. It's the most comprehensive database of individuals in this country. Nobody has that amount of data. Each of those 15 million households has 138 data sets. You can disaggregate by vocation, by sex, by gender, by age, by disability. No register, no database in the country has a database of persons living with disability like the social register. 1.5 million individuals are identified in the social register as being disabled. And you can disaggregate by the type of disability. Those with autism, those with limbs, loss of limbs, blind, deaf. No database in this country exists more than that.
138 indices was what you used to.
Exactly. In the social register, 138. And the beauty is when I came in 2018, the first thing I did was to go back to the white paper that Mr. President at that time signed in 2015 that mandated all databases to align with NIN. And then did the checklist. The biodata in the social register is the same as you take for your NIN and for your immigration.
I was coming to that. If there is a synergy between NIN as well as perhaps other data that we have in the country.
Look, if you pick any information of any individual in the social register biodata, all you need to do to give that person a bank account, it's only your the biometrics. All you need to do to give that person a NIN number, it's only the biometrics
now,
and the facial.
What's also coming to my mind is that we have 62 million individuals. I assume that these are the poorest of the poor in the country.
Yes, they are.
Yeah. Does that mean from your findings at that time, did they have bank accounts?
Most of them didn't have bank accounts. But one of the processes of the data update for NASSCO is to also ensure that these individuals have bank accounts and have NIN.
So how was the cash transfer then done to them?
It was also done through electronic cash transfer. So you see, when the NCTO...
No, I don't understand what you mean.
I will explain.
Okay.
When NCTO mines the data from the NASSCO, from the social register, they go to enroll these beneficiaries. And their process of enrollment is to first take the biometrics and the pictures of each individual caregiver in the household, right? And that individual caregiver in the household is given a bank account number. Now, the challenge NCTO had was the last mile.
And the NCTO should now be the cash transfer, you mean?
Yeah, the cash transfer. And the cash transfer office challenge was the last mile. And the last mile is hindered by the level of infrastructure in our country, right? But good a thing, when COVID happened, you know the rise and the increase in money agents with POS, that we had POS kiosks all over the place. That also saved the day.
Okay,
And
doctor,
so they
I'm
began
trying to
yeah.
understand you. Please just give me, pardon me a bit.
No,
Yeah, pardon me a bit.
I'm here with you.
Yeah, I'm trying to understand the process because
Yeah.
from what, guys, please let's put that list on air now. According to the state, we have 62.8 million household individuals and 15.73 million households. Let's put that graphics on state, Abia, Akwa Ibom, and Kwa. If I have time, I'll go into that. I asked the question earlier. No, not this one, the other one, the tabular one for states. From this from this data, how was cash transferred to? I asked a question. And why I asked that question is because I know that the central bank too is trying to financially include poor people.
Yeah.
So if we have this kind of data, it's just to hand them over, as it were, to the Apex Bank and perhaps the bankers committee or whatever to do what they need to do in terms of financial inclusion. That's one. Then number two, at that time that the Minister of Humanitarian Affairs and Poverty Alleviation was sharing money, how were they able to share money, 5K or whatever it was at that time, I think in some cases 20,000 at that COVID time, to people that did not have bank accounts? That's what I want your explanation on. Were they able to open bank accounts? Because at that time, I remember I interviewed her, and she did not give me a clear explanation. And I told her at that time that I don't see the rationale in you coming to share cash.
Okay. Here's the explanation, right? As we know, we have a lot of unbanked Nigerians, particularly the poor and vulnerable. What NASSCO is doing is for those in the social register, they are working with them to give them NIN. And you know, NIN only became a bit liberalized during the last administration where agents were not given across the country, right? Otherwise, prior to that, you have to come to the NINC office, right? Now, when you have your NIN, you then have access to your bank accounts, right? Now, what was happening before now is that NCTO will recruit what you call payment service providers. They are money agents. They enroll these beneficiaries, take their biometrics, take their pictures. They do not have bank accounts. These agents go to the communities to pay them the cash.
So it was
at
those,
that time,
like POS agents that were paying them.
Exactly. Now, this is how the system evolved, right? We wouldn't be hindered by the lack of infrastructure to deny people benefits. So money agents were recruited duly and transparently. And the system was set up that monies were paid from the TS account to the money agents. The money agents would then go to each community. And this, remember I told you that the community people will select one male and one female to sign on the community list, right? So when it's time for payment, the money agents will go to each community, display the list of the beneficiaries publicly. So the community will take their list and compare to see that there are the people that they selected from their community.
Okay, because there was that issue of that it is a political list. Politicians will get people and put there.
Not with the social register. That I can guarantee.
But we don't have time, doctor. And
Yeah.
Director, just give me 1 more minute. Let's quickly take a look at this list according to states.
Yes.
From my own findings here, I found out that 150 Ekiti State has the lowest households that are poor, 152,005, the lowest individuals, 152,537, and 152,537 households, individuals 573,146. Yes, that's it there. So I'm a bit surprised because I try to juxtapose this data as against even the MBS in terms of even the living standards and poverty, for example.
Yeah.
Do you understand? Because I'm seeing states like Ekiti. I looked at FCT. Where's FCT again? FCT 231,000. So how? Explain this data to me, please.
Okay.
Then the highest number of people that are poor, according to the list at that time, is 4.8 million individuals from Kebbi State.
Yes. You look at that juxtaposed against the population of the country in each of the states. Right? And then go back to the National Living Standard Survey and take the percentage of poor people. By the National Living Standard Survey, Sokoto State is the poorest, right? Over 78% or 86% of people in Sokoto State
Yes,
are just to be
Sokoto,
poor.
yes.
So when you take that against 86% against the total population of Sokoto State, what will you have? Ekiti is around 27%.
But here, Sokoto State is 2.63 million,
Yes.
Lagos 2.68 million. Does that mean that we have more individuals that are poor
Yeah, so
in Lagos than in Sokoto, as it were?
yeah, it is a function of population, and it's a function of the raising of the register. So you start from the poorest communities and local governments, and you work yourself out.
Okay.
By the time you saturate the state, now Nancy, let's look at the math. 42% of our population is poor, right? Meaning 82 million people. Out of these 82 million people are judged to be poor in Nigeria. The social register has 62 million. And the process is ongoing. They've not stopped because they've not saturated all the communities in the country.
Okay.
Yeah.
Doctor, I think we'll do a part 2 of this sometime.
Please, by all means.
Yes, because it seems I've just scratched the surface. I'm not
You have.
too satisfied with today's, today's show in terms of the timing. But thank you very much for coming on the show today.
Thank you for having me, and I'll be happy to come back.
All right, I've been speaking with Dr. Apera Iorwa, former National Coordinator, National Social Safety Net Coordinating Office, NASSCO. He's currently the Country Director of FHI at 360. That's the much we can take. Please join me again tomorrow for another episode of this show. Be the best you can be and be the change that you want to see. I'm Nancy Naji. Bye now.